Alright, so angina pectoris is going to be that pain in the upper chest. Antianginals make that pain go away. Typically, that pain is due to decreased blood flow, decreased oxygen. Like I said earlier, the heart really needs a lot of oxygen. It undergoes aerobic respiration really well, sucks at anaerobic respiration, and so then it starts dying. When it starts dying, you start getting pain signals, right? Three major types of angina. You have exertional angina. This is really predictable. Anytime you try to do physical activity, exertion, you will get pain in your chest. So if you have chest pain, the doctor will be like, does it happen more when you walk upstairs or when you're doing something? To figure out if it's exertional or variant, which is unpredictable. It just kind of comes and goes, and that's due to vasospasms. And so the spasm constricts on the heart or on the vessel, which decreases the blood flow, and then it'll relax, and then the angina just kind of comes and goes, which is a little bit different from unstable. This is like angina all the time, normally due to CAD, cardiac artery disease. Again, with buildup of these plaques, the atherosclerosis, decreasing the blood flow, you are at higher risk for heart attacks, for myocardial infarctions, right? Typically, with people with CAD, like we'll put you on these drugs, but you really have to watch what you eat, start exercising, stop smoking, control your weight. A lot of lifestyle changes need to happen with people who have CAD. So the first and probably the largest group of antianginals are going to be your nitrates. Your nitrates are powerful vasodilators. They reduce the venous return, and so that means there's not as much stress on the heart. So less blood is getting to the heart. The heart doesn't have to work as hard to pump it out, which means it consumes less oxygen. And so it can survive on less oxygen because it is working less. What it does is all of them are converted into nitric oxide, which then relaxes the vascular muscle on those peripheral blood vessels to cause the vasodilation. Works best on veins, so it more venual dilation than arterial dilation. Nitroglycerin is the go-to for your nitrates. You can get it a bunch of different ways. Sublingually, this is for when you have acute angina and it comes on really quick. You put a sublingual, put it under your tongue, goes to work in about 1 to 3 minutes. It starts working, peaks at 5 minutes, and can last up to 30 minutes. So it's just for those really powerful bursts of angina. Ointments, you put your nitro on the skin, cover it with plastic wrap. This is prophylactically, so you can wear this throughout the day if you have a lot of angina. We also have extended release capsules. Again, you're taking those prophylactically and they last 8 to 12 hours. Or transdermal patches, basically kind of like the ointment, except it comes in an already formed patch. Slap it on, you can wear it throughout the day. With all of these, though, you develop tolerance really quickly, and so it is recommended that you do not have nitroglycerin for 10 to 12 hours a day, so you're not building up that tolerance. Side effects include flushing, because it is dilating the blood vessels, headache, weakness, fainting. It can cause reflex tachycardia. So if your blood pressure gets too low, your heart gets signals from the brain that's saying, hey, your blood pressure is too low. And so that sympathetic innervation causes it to beat faster and can cause tachycardia that way. It is also contraindicated with Viagra, which means you cannot take Viagra and nitrates at the same time. Alright, beta blockers, again, beta blockers. We talked about them, right? propranolol, atenolol, metoprolol, Lopressor. All these can treat angina for a long time, so it's kind of like your go-to if somebody has angina and it's not going away. You can use them with your nitrates. They'll make you drowsy, tired, can give nausea, diarrhea, and also hypotension. Thankfully, beta blockers block beta adrenergic stimulation. And so if you're on a nitrate, and a beta blocker, you don't have to worry about reflex tachycardia because you're blocking that with your beta blocker. Calcium blockers, we already talked about them, right? There are some other ones that are also potent vasodilators that we didn't cover up here. And so, nicotardipin, very good vasodilators, very little effect on the heart, can have headaches, flushing, hypotension, constipation, can cause reflex tachycardia, so typically if someone's going to get a calcium blocker, they will get a beta blocker too. I know, that is a lot of drug names in a short period. Hopefully you can get to sleep.